Let's discuss the four main types of shock, which are medical emergencies where the body is unable to adequately deliver oxygen and nutrients to tissue. This leads to cellular dysfunction and organ failure. Understanding the different types of shock is crucial for early recognition and management. Here are the key concepts that you should know about the four main types of shock. The four main types of shock are hypovolemic, cardiogenic, obstructive, and distributive. An easy way to remember this is use the acronym CHOD, C-H-O-D, CHOD. Let's start with cardiogenic shock. Cardiogenic shock arises from the heart's inability to effectively pump blood, hence the name cardio, meaning heart, and genic, meaning generated from. This is often a result of heart failure, which can be caused by things like myocardial infarction or trauma to the heart. The next type is hypovolemic shock. Hypo means low, and volemic refers to volume, and emic, meaning blood. Hypo, low, volume, emic, blood, low blood volume. This occurs when there is a significant loss of intravascular fluid, leading to decreased circulation of blood. This can result from a hemorrhage or dehydration. If it's resulting from a hemorrhage or bleeding, it would be known as hemorrhagic shock, which is a subcategory to hypovolemic shock. And if it's from severe dehydration, such as with a patient who has been nauseous, vomiting, and having diarrhea for several days, then the subcause to hypovolemic shock would be dehydration. The next type of shock is known as obstructive shock. Obstruct as in obstruction. Obstructive shock is caused by a physical obstruction to blood flow, such as in a pulmonary embolism, cardiac tamponade, or a tension pneumothorax. When it comes to obstructive shock for pulmonary embolisms, the pulmonary embolism or blockage is preventing adequate blood flow. This physical obstruction makes it associated with obstructive shock. With cardiac tamponade, the sac around the heart called the pericardial sac is filling with blood. This will compress the heart and decrease the heart's ability to pump effectively, therefore decreasing the ventricular ejection fraction, or in other words, decreasing the amount of blood that the heart can pump out. And lastly, with tension pneumothorax. With a tension pneumothorax, air is entering into the chest cavity and collapsing the lung. But it's not only collapsing the lung, it's also putting pressure on the aorta and the vena cava, the largest artery and the largest vein in the body that run through the chest. The increased intrathoracic pressure puts pressure on those two major blood vessels and physically restricts adequate perfusion through those blood vessels. This again is why it's known as an obstructive shock. The last type is distributive shock. With distributive shock, you can often remember vasodilate, because with distributive shock, there is widespread vasodilation leading to a decrease in circulatory volume. The three subcategories to distributive shock are septic shock, anaphylactic shock, and neurogenic shock. With septic shock, the body's reaction to an infection is resulting in systemic vasodilation, or the relaxing and dilating of the blood vessels throughout the body. This same concept happens during anaphylaxis, where the immune system is now reacting to an allergen instead of an infectious material like it does with sepsis. Even though anaphylaxis is related to the immune system's reaction to an allergen, a very similar physiological response occurs where there is vasodilation. And lastly, with neurogenic shock, the nervous system is no longer able to communicate with certain parts of the body. Therefore, the brain cannot tell the blood vessels to constrict, and as a result, they return to their natural state of relaxation or dilation. This also results in a decreased amount of perfusion to the vital organs and is considered a type of distributive shock. To simplify, remember CHOD, C-H-O-D, cardiogenic shock from heart failure, hypovolemic shock from hemorrhagic shock or bleeding, or from severe dehydration, obstructive shock from a physical obstruction such as a pulmonary embolism from cardiac tamponade or tension pneumothorax, and lastly, distributive shock, where there's widespread vasodilation from septic shock, anaphylactic shock, and neurogenic shock. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.